All right, good. Okay, well, let's get started. So it's a little bit after noon Central Time. So welcome to the February 2024 US ENT Supplier Spotlight. We're always excited about these, but we're really excited today to talk with the four guests that we have from Tungsten Medical, and then Dr. Boxwell, one of our US ENT members who was on a previous spotlight back in December. And Tungsten does many, many things, but the core of their business is in-office CT scanning. And you may have heard me talk on this topic before, but in-office CT is one of the pillars of new revenue opportunities for practice, both directly and indirectly. So you might remember the story of my own practice, Collin County ENT here in North Dallas. So before October of 2017, when we put in our first CT scanner, we shared a CT scanner for several years. We leased it and we had the scanner on Mondays. But Monday's an OR day for me, still is. And so I never had the luxury in those days to have same day CT scans, be able to review them with patients. And so finally, our practice got to the point in October of 2017 where we purchased a scanner. And I think it was October 23rd when it was installed. And October 24th, we wondered what the heck we did without it. Within one day, we couldn't believe how much it had revitalized and revamped the way we practice. Now, obviously, things have changed a little bit from reimbursement, but if we travel back 7 years, all of a sudden we had the opportunity to see a new patient or a follow-up patient, walk them down the hall. The physician could obtain a CT scan. Back then we had an X-ray tech, and we'll talk about some of those nuances. So either the physician or the X-ray tech took the pictures. 20 seconds later, we were able to go through the triplanar CT scan with the patient and come up with a plan. And we immediately saw an uptick in other services within our clinic. So office procedures like balloon sinuplasty, traditional sinus surgery in the operating room, even allergy testing. And that has been sustained even through the pandemic, through the ups and downs of the market, through United Healthcare getting even worse to work with, all of the above. We have still a significant uptick in business because we have in-office CT. In fact, we installed one in a second office of ours at the beginning of 2023 because it was just so drastically different practicing in that office versus the office where we had CT. So that's my story, but that's the story you hear all throughout US ENT memberships and throughout ENT offices. And so that's what we want to talk about for the next 25 minutes or so with the Tungsten Group, and then have Dr. Boxwell talk about his own personal experience. So I'm joined today by the founders of Tungsten Medical, David Luick and Mike Luick. As you might guess, they are related, so they can introduce themselves here in a second. And also a familiar face for many of us in the ENT world is Rachel Gajda. Many of us worked with her at another CT scan company 10, 15 years ago, and then at Stryker for many, many years, even though she's only 29. So she's had a long career in ENT and now leads the sales efforts at Tungsten. Last but not least, if you didn't join us in December, we're joined by Dr. Dan Boxwell from South Carolina. Dr. Boxwell is a brilliant person with a variety of interests, but a fantastic physician and fantastic surgeon. He recently left a employed situation with the hospital system and has founded Atreus Medical and Surgical, a multi-specialty group. And he'll talk a little bit about that and then specifically where it overlaps with in-office radiology. So with that, I will shut up and David, Mike, let you guys talk a little bit about the history of tungsten. And then as we wrap up, I want to be sure to save time and talk about why US ENT has chosen to strategically partner with Tungsten. But I'll let you guys take it away for now.
Thank you, Dr. Matheny. My name is David Luick, and my journey with in-office CT started 18 years ago now. I started on the vendor side. Actually, one of my first projects was writing the user manual. So I'm intimately familiar with, the operation of in-office CT. And somewhere around maybe 10 years ago, I started to notice that in-office CT was starting to become a commodity. And so, to be frank, um, I started Tungsten 8 years ago, and the goal was to just take something that was ubiquitous in the market and make it better. The market had an obvious need and a desperate need, frankly, for better products and better service. So J. Morita was the obvious choice for us to partner with a manufacturer that has been doing in-office CT for actually, J. Morita's been around for over 100 years now. So they were an obvious choice for us. I've actually assembled and disassembled hundreds of in-office CT scanners. So I can tell you down to the component level, the J. Morita is an excellent product to work with. But customers that upgrade from another manufacturer to Morita will notice the difference immediately. And we have hundreds of customers now that have made the switch to tungsten. Those are going to be our best references. On the service side, we had to put a team together, and we have put a team together of very talented people. So we have a couple with us today. I think, as you said, Dr. Matheny, most of us know Rachel, and Rachel Gajda and I have worked together for, gosh, almost 10 years now.
Way more than that. It's like,
Yeah, maybe more than that. So let's just call it 10 years.
Let's go with 10.
Yeah.
The math starts to be a problem, David. You got to always, minimize the years.
Yeah.
Come on.
Just say
Come on, I'm trying to help you out here.
We started working together when we were 19 years old. So that checks out. But beyond being just passionate about what we do and being good at what we do, we truly enjoy helping people. And actually, a little known fact is that one of our employees actually started a charity to give back and help disabled people in the community. And so it goes without saying, if we're passionate about helping people, we're certainly dedicated to helping our customers. So if tungsten isn't a household name for you yet, then I encourage you to just Google us and check out what our customers are saying about us. But we service all brands of CT scanners. So if you make the switch, you'll notice the difference in service right away. We answer the phone when you call.
Yeah, that's far and away what we heard, and frankly, why we partnered. My colleagues that are on the call are probably snickering, but for years we have bumped up against tungsten, and I say that in a complimentary way. So many of our practices, and we're now fortunate to work with thousands of physicians. So many of our practices, no matter what the brand of their CT scanner was, had this pesky little company called Tungsten doing the service. And we asked them why, and universally it was because the customer service was unparalleled, not just in-office radiology, but really amongst any of our suppliers that we have in ENT. And I heard that time and time again. David, I did have a question about the J. Morita for those of us that aren't familiar with that particular brand. That's primarily historically been a dental scanner, right? So we all work with dentists and oral surgeons. They send us a lot of patients for tonsillectomy and other sinus problems. And so that's a common scanner in a dental office, right?
It is. Actually, every cone beam CT scanner in the medical market started out as a dental scanner. So that's really common to see. It's the same technology. It started out in dental, and now they operate in the medical space.
Good. All right. So when did you finally relinquish and allow Mike to join you?
The truth is, I was actually chasing Mike, just like I was chasing Rachel, to come join Tungsten for many years, and an opportunity came up with both of them to have them join the team, and that's a story with a lot of our employees. So now we have a real robust team. But thankfully, Rachel joined us just last year. Michael joined us a few years ago, and I'll say beyond just being passionate about what we do, we actually enjoy it. It's fun for us. I tell our customers all the time, anytime you want to talk about in-office CT, you can call me. If you want to call me at 3 o'clock in the morning and talk about in-office CT, I'll probably be awake. My wife might
Okay,
just had
well,
a baby girl a
duly
couple months
noted.
ago,
Duly
so
noted. I'll be sure to do that.
I'll take you
All
up
right,
on it.
so
I'll
now,
probably be awake. So you can
well,
call us anytime. But I
those
think
of
that
you that
is,
know me know I'll be up too. I'm
yeah,
not a great sleeper. So, in-office CT, that seems very daunting. Now, the people on this call in general and people that are US ENT members are very sophisticated from a business standpoint. But when we talk about this topic, there's still a lot of glazed over eyes and a lot of intimidation about CT. So how, like my practice in 2017, how does a practice even go about this topic? What space do you need in your office? Don't you have to drop lead in the walls? Don't you have to hire a X-ray tech? I mean, I guess what are those kind of logistics if a practice is even entertaining this crazy idea?
Sure. So the truth of the matter is there is a lot that goes into acquisition and maintenance of in-office CT. And I'll Quentin Tarantino for you. I'm going to tell you the ending. That's what Tungsten does. So we make it very easy for you to own in-office CT. You mentioned space requirements. That's often one of the first questions that comes up. Can I even house this scanner? Dr. Boxwell is a great example. It's a tiny room we put it in. I think it's 6 foot by 8 foot is that room there. We've put it in, that's about as small as we would go, 8 by 8, 8 by 10. The scanner itself is 3 foot by 5 foot. But a typical room, a typical exam room will house the scanner. We've even retrofitted walk-in closets before that were housing old fax machines and phones that no longer work and paper towel. I think a lot of people can empathize with that, and turned it
So
into
that's great. So
diagnostic imaging. Yeah,
yeah, most of us can find a corner like that that's not certainly not
exactly.
generating revenue for the office space. Now, what about, I guess, what about the radiation? You know, that was a big concern. Most of us have employees of all ages, certainly females of reproductive age, and so we were
Yeah.
very worried. Obviously, ENTs take care of thyroid disease, so we're worried about radiation exposure to our necks. What, I guess, comment on that? What is the radiation dosage that the staff reaches, or what precautions do you have to take?
Sure. There's a good bit that goes into that. The first thing is this is very low dose. So the patient is getting 0.17 millisieverts, which is equivalent to 2 weeks of background radiation from walking on planet Earth. The equivalency I really like is it's equivalent to a round trip flight between New York and LA. In terms of leaded shielding for the room, the answer is solid maybe. The real answer is you probably won't need it. A majority of our installs don't need leaded shielding, but it'll come down to a multitude of factors, which include number of scans per month, the size of the room, and then the placement of the scanner within that room, and largely utilization of the adjacent rooms on all 4 walls. And all of those factors go in to the calculation to whether or not walls need leaded shielding.
Right,
We do
because the
that.
pipes and even the studs, a lot of those things will absorb some of that, right?
All of that stuff goes into it, and we'll do the math for you, and we'll do a drawing. We'll tell you which walls need lead, if any. And if there are walls that need lead, we can get leaded drywall shipped anywhere to the country and installs just like regular drywall, and it's really pretty easy to do.
Okay, good. All right, so we found a closet to put this 3 foot by 5 foot scanner in. Now, what are the next logistics? Namely, who can do these scans? Can our front desk person do the scan? Does the doctor have to do the scan? Both who can do the scan and then who can do the scan, meaning what payers, are there differences amongst different states, those kind of issues?
The answer to that question changes across the country. So we install coast to coast, and some states are going to require some fancy letters after someone's name, MD or licensed RT, in order to push the button. South Carolina, for example. North Carolina has almost zero credentialing requirements. As long as you're trained, you can push the button.
So like your teenager can come in and push the button, I guess.
More or less. They need to be
Yeah.
trained, but they need to work there, of course. But it's interesting. Other states have requirements on whether or not the barrier can be mobile or fixed. We catalog all of this for every state. So South Carolina, another example, they're pretty strict. They require fixed barriers, where North Carolina you could have a mobile barrier, and you can have anyone push the buttons, as long as they're trained and they know what they're doing.
Okay, good.
In some states, we find a good workflow is an MA will situate the patient in the chair, get them positioned right, get the lasers right where they need them to be, and then MD will come in, double check everything, and actually acquire or push the button.
And that's how we do it in Texas, so
popular.
we definitely utilize staff to help us, so we keep the clinic flow going, but stay right in the middle of compliance. So, okay,
to add
go ahead,
on,
Rachel.
so if you have volume where, the doctor obviously has, call it, better things to do than go in and press the button on the scanner. If you have the volume, sometimes an X-ray tech can be justified, because the benefit of working with Tungsten and the experts that we have is that we'll train them. We'll literally do everything for them in terms of training, radiation safety, etc. So the only thing that they have to do is just push the button, and you don't have to worry about any of the training that goes along with it.
And Rachel, how we used our X-ray tech, we don't have her post-pandemic, but we had her for many years. I mean, she was extremely valuable in assisting in surgical procedures. She was an extra MA, would help us out. So we didn't just have someone sitting there twiddling their thumbs, although we do a million scans every day. She was utilized in other aspects of the office, so it made it worth her salary. So that's a great point. Okay, so obviously these are not inexpensive machines, as we've traditionally sent these over to radiology centers or hospitals. So I guess, what financing options are available through Tungsten? And I know Dr. Boxwell will share some specifics of his deal, but I guess, what can customers expect?
Sure, I can take that one. So it's been really interesting kind of seeing the evolution of the cost of ownership of a CT scanner throughout the 16, 17 years that I've been in the industry. I would say the first probably 8 years, it was all about ROI based off of how much money am I going to make per scan. So ROI was just based on volume and how that equals whatever reimbursement is tied to 70486, the sinus and temporal bone codes. But what we have found is that I'm going to use a term that my good friend Bob Glazier kind of coined. It's a loss leader from the perspective of a practice. So what does that mean? That basically means that, yes, you are going to receive some reimbursement for the codes that you're going to be billing for, but the real value is tied to the efficiency. So having a patient come in and same day, or even if it's shortly after, having the efficiency of them being able to get the CT scan done at a point that is convenient for them and that is convenient for you. I oftentimes use the comparison. If your dentist told you that you had to go to some outsourced imaging center to get an X-ray done of your teeth, I know I would never follow through with that. So we've actually found that patient retention increases by 40% when you have an in-office scanner. So out of 40% of those patients that you would have otherwise lost, think of how many candidates there would be for surgery and other services that these practices have. So, and then additionally, there's the clinical advantage. So a patient comes in, they're experiencing symptoms, and Dr. Matheny, Dr. Boxwell, you know this more than I do, but if you have to send them out and you have to give them some kind of medical management for a couple of weeks, and a couple of weeks later they get a CT scan done, all of their symptoms might not still be present. And so you're not doing your job as a physician to really be able to treat them when they're having these acute symptoms. So there's many reasons. Now, obviously, there's a cost of ownership, right? It does cost something to buy a CT scanner, but we've partnered with financing companies to offer a lot of different solutions that just make sense for the customer. So direct financing, obviously, deferred payments. We offer deals for up to 10 years of a term. And we've also partnered with some of the leading, like, big capital device or disposable companies in the industry too. So if you're using balloons or other disposables, we have programs that allow you to pay for the cost of the CT scanner through your use of disposables, which is pretty unique.
Yeah, great point. And many of you know, listening in or watching this in the future, we have those options with both Fuel, the hearing aid group, as well as Stryker within US ENT. I'll just say quickly, and then I'm going to shut up and let Dr. Boxwell expand. But for my practice, both of our CT scanners, our financing note is, a little bit over $3,000 a month. So we only have to be reimbursed for 30 scans, which again, we can do in one day. Easily, certainly in a couple days, if you throw out the Medicares and the other payers that don't pay for in-office CT. And then we're in the black, just literally, but the indirect return on investment is so much higher with elimination of the leakage that Rachel was talking about, just from having to walk across the street to a radiology facility or come back in a couple days and then come back a third time to actually review the results.
Right.
So Dan, why don't you jump in and talk about, your decision to put in office CT in Atreus, and then why you chose Tungsten, and then maybe what your financing looks like.
Yeah, fantastic. Thanks for having me to be a part of this. From the get-go, one of the reasons I wanted to be in private practice was so that I could bring the most advanced technology and options to my community. So I'm in rural South Carolina. We're about an hour from the next biggest city, halfway between Charlotte and Atlanta. So we've got a large rural population. They may drive, 45 minutes, an hour from, the Georgia mountains, or up even across into North Carolina mountains, just over the border. So the convenience aspect that you brought up, and as creatures of convenience, as we continue to evolve, people want it now. They want it their way, and they want it now. And that's okay sometimes, and especially when we can offer a service like this, where I also want an answer right now. So whenever we're able to pair up that capability of, all right, you're here right now, I'm here right now, you feel sick or you don't feel sick. Now, let's go down that pathway, and we can split those hairs and get answers faster. When they meet everything's under meeting the correct indications to actually do a scan. But we can give patients feedback right away, real time, and it just makes a huge difference.
And that's huge, Dan,
the
right?
Relationship, yeah.
You and I spend so much time talking to the clowns at the third-party payers, specifically United Healthcare. Not that I'm biased, but I am. And so you have to catch that patient, even though they've literally, United has paid for 18 antibiotics in the past 2 years, and all this other stuff. You have to catch them when they have 4 millimeters of mucosal thickening, not 3.
Right.
Or you can't operate on them, right? And so there's just no way to do that unless you have in-office radiology. What we do, I'd be interested to hear what you do, is we have patients come in when they're sick, and we don't charge for the CT.
Yep.
We don't even schedule a formal appointment. They just know, hey, we've got to scan you when you're sick to prove that you're sick. And so the convenience of the in-office CT, that alone is worth it in being able to care for these patients, to actually operate on them and help them. Right. What do you see as similar?
Yeah, absolutely. So there's that whole patient population that, I've waited 3 weeks or 6 weeks or 4 months to get in to see you, and I don't have symptoms right now, but they're going to be there 2 weeks from now. Well, it's a whole lot easier for me to say, walk in here. I want to get it when you feel like you're having your true symptoms, as opposed to saying, well, when you have the symptoms, call me and we'll try to get you worked in at the hospital or at the standalone center, where I have no control over their scheduling and their capability and their interest in actually working in a CT scan.
Or you wait to treat them, right? Say, okay, well, I know you feel lousy, but wait a couple days because we got to get this scan done on Friday, and then I can treat you.
Right. And so I had that exact patient yesterday that they're like, I've been on so many antibiotics, and I just kind of started feeling better, and then now it's full force again. And in the very fine pathway between migraine and sinusitis, patients don't buy migraine for mid-facial pain and pressure when they have congestion, but you can get all that with migraine. So being able to say, okay, you're symptomatic right now, this is what you're talking about. We get the images right then. Now they can buy in that it's not a surgical management on the front end, that there's a different pathway that's not infectious.
Yeah, that's a great point.
It doesn't mean that they're not a candidate for balloons if it's a barometric pressure across the sinuses, but that's a harder sell for insurances as well because of the mucosal thickening and those sort of things. But now the patient believes you, that the specialist in this, that it doesn't have to be an infectious process. It just needs bigger antibiotics or more or longer. So So the buy-in for patient belief is the buy-in for patient getting better and for their health. So
I love that.
that's
I love
that's
that
one of the greatest
perspective.
things. Yeah. So for both sides, I mean, the capture, the convenience, and one of the things that Mike alluded to earlier, you send them to a CT scanner at the hospital or at a standalone center, they're getting 10 times the amount of radiation for that one scan.
Yeah.
So when we talk about the effects of radiation and the field of view for that radiation over the course of their lifetime, we're continuously learning more and more about radiation and its long-term effects. And so I feel like I'm also minimizing the risk for the patient for collateral damage. So
excellent points. So I want to reserve a little bit of time for questions, so feel free to raise your hand or type something in the chat. We've already had several come in. So right off the bat, I guess we didn't cover this, but the question is, who can interpret these? Do you have to have a radiologist reading these CT scans? Can the physicians do that? Can anyone do that? Mike, David, why don't you take that from a interpretation standpoint?
So by and large, we encourage our customers, our doctors, to interpret their own scans. And I would say over 95% of them do just that. It's certainly possible to send out the scan for a read at a radiologist, and we can set you up to do that, but I don't see any benefit. There's a lot of docs have asked us about legal liability or risks interpreting their own scans, and I think that's easily managed in the report itself. It literally says this is a bone window CT. The field of view is sinuses only, so you're not looking at the brain. And looking at sinus scans, I think is something that ENT physicians do.
That's what my legal
often
counsel has said.
and easily.
Those kind of disclaimers protect us because we do interpret our own CT, and
Right.
we do have CME requirements, radiology CME, so different than our ENT CME to do so. But I concur. Not only is it convenient, but it's very important, as Dr. Boxwell can attest. A lot of times, a radiologist that doesn't know the patient's symptoms or history will undercall something or omit something in accident, and then that's set in stone, and it's another reason for the third-party payer to deny care, to deny the ability to take care of these patients. Go ahead, Rachel.
A lot of times a barrier to entry, if you will, are accounts that say, you know what, I'm owned by the hospital, or we have a strong relationship with the hospital, so I can't stop sending my patients there. But
or invested in the hospital.
Exactly, yeah. So one solution that a lot of our customers have actually found is they will continue to have the radiologist do the interpretation. So receive the professional component, and they get the technical component. But as we said before, it's not, the value isn't the technical component. It's having the advantage for all of the reasons that we already listed and having it in your office. So just wanted to point that out.
Great point.
Great point.
Yeah.
Another question that just came through. So when we talk about the lower radiation, how detailed are these scans? Are these scans able to be used in the various navigation platforms that we have with our balloons and microdebriders and things?
Short answer is yes. Yeah. We can, export onto a CD or a USB. We can do a DICOM push to any image-guided surgery system. It's actually very easy to set up, and we do it literally hundreds, if not thousands of times a day.
Okay.
And
one quick
sub-millimeter as well. So most image-guided surgery systems often require like a 1 millimeter or less slice thickness, and ours is much more fine than that. But as David pointed out, we can customize settings so that it just immediately exports the way that you need it.
Yeah.
Okay, good. And then question for Dr. Boxwell. So if you don't mind sharing, how did you structure your financing? Maybe it's different than how we did in ours.
Yeah, it's a great question, and Mike made it real easy as far as giving me options. So he was like, all right, well, there's some different ways that we can do this. We got through, I'm not sure, Rachel, if it went through you first or how that first functioned, but I got terms back, and they were very good. Because of my relationship with my community bank that has been very, very supportive of getting Atreus up off the ground, I reached out and said, hey, what would I be looking at terms for this? This is my expected ROI just because banks want to know just a straight up how many scans, how many have you done a month for the past 3 that you've sent out that you'd be getting that money back. So I gave them that information, and the local bank basically tacked it on to an existing loan at a very reasonable rate. So, but there was nothing, hardly anything to beat with what I was offered through Tungsten as well. It's just staying with my local community bank because
that's great.
They're so supportive. So yeah, there's a lot of options. Depends on the relationships.
Well, as always happens, you look up and time is already up. So obviously this is a really hot topic and something that is on practices' minds or a situation that a practice has used for years. But I just wanted to wrap up with why we chose to partner with Tungsten. So we have seen, again, before we were partners and certainly since this partnership crystallized, the amazing commitment to service. And when we were just talking about what we wanted to convey through this webinar, it was giving physicians their time back and truly taking everything off of their plates that they can to make this in-office radiology easy. And we see them throughout our US ENT membership do that on a daily basis. So we're really honored to partner with Tungsten. We encourage you, if you have one scanner and you're thinking about a second one, contact Tungsten. If you are not happy with your service, which we hear all day, every day, with your existing service provider for your existing CT scanners, call Tungsten. You will not be disappointed. I say that from a personal standpoint as well as from the US ENT standpoint.
I think
well, that concludes. Oh, go ahead, Rach.
I always have to have the last comment here,
Yes, you do. Yes, you do.
I do want to just say too that the reason why we chose to partner with you as well is because there's a commonality with the value that we strive to provide for our customers. And I've been at many companies, large and small, over the years, and I think what really sets Tungsten apart, that I think you can, you obviously are doing this as well with your membership, but we actually do what we're saying we're going to do. And everybody at the company, Tungsten as well as US ENT Partners, they care, and they care about patient care. They care about putting the customer first. And I think that's one of the reasons why we know that this partnership already has been and is going to be just tremendous. So just wanted to also applaud you and everything that you've been doing for your membership.
Totally agree.
Thank you.
Absolutely.
Couldn't have said it better. Well, with that, then let's end there. That's perfect. So that concludes this month's Supplier Spotlight. If you need any more information, of course, reach out to your US ENT account managers. We'll be posting this as soon as it's polished up and edited on our website, probably within 5 or 6 business days. So you can watch this back. And as always, you can reach me directly. So have a great afternoon, and we look forward to next month's Spotlight. Take care.
Thanks.
Thank you.
See ya.